should the intensity last?
30 seconds.
About 1 minute.
60 to 90 seconds.
Yeah.
Is actually how intense those contractions are going to be.
That's bad.
Also, what about if she has that sudden urge? I got pushed!
No,
I
you
got
don't.
pushed!
No, you don't.
Put the ass
Plug in it.
between your knees. You know.
So we're going to look for crowning. She's got these strong contractions. They're very intense. You actually, you see it. Okay, we've now decided we have to deliver this baby here. We don't have time to transport. We can't do that. We got to do it now. So who needs to be present for the delivery of the baby?
Somebody besides me. Somebody besides me.
The mother. So we got the mother. Who else?
My backup.
My partner,
Your
because I'm
partner.
fixing to have 2 patients.
And you. You
No,
and your
I'm
partner.
going.
And get the second crew coming.
Second crew.
Get
Right.
another crew coming. Okay, what? I don't understand. What supplies would you use?
What supplies? Boiling water and towels.
You got it?
You don't need the title was you don't need towels, duct tape, and boiling water. You
I'm
need,
sorry.
Nailing
It's on the
wire,
phone,
pulling chains, all of that.
you
shit.
need your OB
I got a
kit,
cat puller.
your partner.
Strap.
Don't you need a come along?
Catch your blood.
As a paramedic, all I need is an EMT.
There you go.
Exactly. So this is a basic level skill.
EMT. I
It is
have
a
no
basic
need
level.
to deliver a baby.
The basic skill.
That was a tacky statement.
This one's yours.
But something else that we do need to consider
deliver babies
is
in
what
Pablo.
is our scene? Where is that mother actually at during the delivery process? Is she in the pickup truck out in the middle of the field?
On the toilet.
In front
Is
of
she
the
on the
Holiday Inn
toilet?
on that Broadway, sitting sideways in a 2-seater car.
Yep.
There you go.
Back
So
seat
we
of the
have
taxi.
to take our
Orange
scene into
Broadway.
consideration as to also what type of equipment or supplies might be needed for the scene itself.
PD.
So when do we use the different pieces of equipment for the delivery process itself? So we've got our OB kit. Let's go through just a few of the things that are in here. So initially, what's our very first thing that we do when we get on scene?
Scene safe. Gloves.
Our scene
Gown.
safe.
Mask.
I don't know,
Both
depending
kids.
upon how upset she is, it may not be safe, but we're gonna assume that everything's safe. We need our BSI. So what should our BSI be, our considerations be for the delivery?
Level A has that.
Right there with him.
So,
Speaking from experience.
There's a gown that's in there that we need.
He's got a
we
baby.
need, most of us are gonna put on our gloves, yes?
Yes. Yes.
All right.
You ain't delivering
So,
a baby until
we
you
are
deliver
actually in
one.
our OB kit, we have
I have.
sterile gloves. We're gonna put our gloves on.
Sterile gloves.
And they become unsterile the moment we open them.
So, we also should have splash protection.
Yes, ma'am.
So, eye protection,
Explosion protection.
explosion protection. So
Hopefully
we've
that
got gloves
explosion's
that
already
we're gonna
occurred.
put on. We've also got this nice little handy apron that we're gonna put on. Yeah, like this is gonna do a whole lot of good, but it's what they come with.
Like I said, level A hazmat.
Yeah.
Yeah.
Wait a minute. Okay. Rod, stand up.
So actually, in your OB kit,
Hold that
there
up
should
a
be a
minute.
pair of sterile gloves.
It's only half an
That's not
apron.
helping some of us.
I was gonna say,
Won't help me.
that's what I was gonna say at the beginning.
I've seen toilet paper bigger than that.
Well, that's what it comes with. Also, the trash bags work well in
Right.
the unit.
See, that's what's that going.
Do you know I'm recording this? We're gonna see it on YouTube,
Yeah, well, yeah.
and everybody's gonna know that Keith Edmonds used toilet paper bigger than that.
So yes, the trash bags, you can actually, they work very well, especially if you have the big, like the 30-gallon trash bags. Cut a hole in the top, stick your arms through, make a great coveralls.
Makes a good Boy Scout ranger.
That's right.
So
Wow.
this is where your partner comes in handy. They're gonna dress
Oh,
you
hell, my
well.
partner be passed out by now.
My old partner's been back in the truck. I can't handle the smell, Keith.
So we've got our splash
You ever take a
protection.
shower?
Okay,
You know
our
how I roll,
BSI is being taken care of at this time. What's next? So we got our BSI on, we're saying, okay, it's time to go in, we look, it's crowning, the baby's crowning.
He needs
Head
to
comes out, what's next? What's the first thing we're gonna do with this baby? We're not gonna let this baby come out. We're gonna suction.
Yeah, give him a excuse. Give him a.
So what gets suctioned first? We got a bulb
Mouth.
syringe. Sorry?
Mouth.
The mouth, and then the
So,
nose.
There's a
Thank
partner.
you, thank you, that's a good
Where's the clothespin?
Yeah, that's right.
When I'm actually suctioning, do I place it in and then squeeze?
No,
No,
squeeze.
we're gonna squeeze first and then pull out. And do we do this just one time, or does it sometimes take multiple
Multiple.
attempts?
Till it's clear.
Multiple attempts.
Make sure
So
there's no
he's gonna
meconium.
suction the baby's mouth and then the baby's nose. So baby has been expelled, right? We've got our hand there, we're catching, baby's coming out, baby's been expelled. What's the baby attached to?
Cord,
The
The
cord.
mother?
What do we do with this cord?
we deliver it. We
As
plant
a
it,
cord-
I'm sorry.
No, it's fine. No, this is very interactive
Give
group.
her a
That's what
rope.
I'm wanting. That's what my
Pete,
wish is.
give her a
So
rope.
we've got the cord that's coming out. The cord, when do we decide to
Hey,
clamp
here's
and
your
cut the cord? When do we clamp and cut the cord?
When it quits pulsating.
Very good, when it quits pulsating. So what comes first, the clamps or
What comes
the
first?
cut or the clamps?
I would clamp.
Clamp,
We're gonna clamp first.
About 10 inches.
or we're gonna be
I
bad dirty.
guess that depends upon how mean the mother was to you. I don't know.
Yeah.
Why would it be important to wait for the cord to quit pulsating?
Volume depletion on mama.
If it's pulsating, there's blood still flowing through there.
You can, all of a sudden,
This is
you
where
have
your
a
trauma's here.
extremely hypotensive
Here
patient.
came my- Oops.
Dang, I hate it when that
So he's
happens.
gonna apply the clamps. How far apart should the clamps be?
7 and 10. From the baby, not the mother.
2 and 10 is what I was on.
Yeah, 10 and 7 is what I always say.
Main thing is
3
leave
inches
the
apart.
main thing is
Yeah.
leave the hospital enough to work
I
with.
never,
Work with.
that's what I was gonna
Because
say, always
they
leave enough to work with.
They bob it when it gets there, that's the first thing they'll do.
I do it about.
You know, y'all brave, I'm a mean bastard. I ain't getting that much.
I'll be more than happy to open this. I kind of prefer not, just 'cause I don't have a sharps to place it in. But
We've
your
got
scalpel-
some up on top if you prefer, but your preference.
Don't cut my rope.
So we've got it clamped, then we're gonna cut in between the clamps.
Let Dad go.
Now, what's coming next?
You just load
Let's
Mark,
set it up.
mark the
The
time.
placenta!
Mark the time of delivery.
We do need to mark the time of the delivery.
Mom will be really mad if you don't.
So sometimes we get close, may not be 100%.
You make something up. Oh yeah, it was time of delivery.
When you get to
So what do y'all
the
think this
time
is
of
for?
That's the placenta.
Why would it be important for us to carry the placenta with us?
They examine.
Because they may want to eat it later.
You need to make sure it's all there. If it's not,
Yeah.
you could have a
There's
toxic
problems.
female in a couple
Thank you.
days.
Oh, well, I'm kind of with Scott, that's the only thing I
And the
use.
feminine pad, why?
Bleeding.
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 Bleeding control. What could work if the pad's not present in your kit?
An ABD,
An ABD pad,
8x10.
trauma pad, something. Some just cleaning sponges.
That's not enough.
This is where we were talking about, you don't necessarily need the towels because most of your OB kits are gonna come with a chuck. What is this big white thing for?
The drape.
That was what we should have draped for Mom.
Yeah.
No.
Well, there's drapes and there's
It's
a blanket
baby
for
We
the
don't,
baby.
we don't really
Clean
have
over
a
windows
right.
and ambulance.
That's
This
a-
is what they have used as for the blanket for the baby. What could be something else that be found almost in any house that could be used in order to keep the baby warm?
Bathtub.
Bath towel,
Bath towels? What else?
Sheet.
Sheets?
aluminum foil.
Cases.
Aluminum foil, that's where I was going, aluminum foil. I'm sorry,
Silver swaddlers.
the silver swaddlers. You guys remember those? Sometimes people would have the aluminum foil on their units
Also
instead of the silver swaddlers. So does everybody understand the different pieces of the items that are in your OB kit and how they're all to be used? Any questions about the OB kit? Or the,
You lost the baby.
well, I've actually started to bring.
What are you using over there to
We
keep
have a
the
bucket.
warmth in the head? What
You would-
particular kit?
He's my
Close at 5.
It's called I don't know if there's any way to put it other than a taco roll. You actually, the way that, I wish I'd have brought a baby doll now to demonstrate it. but-
Oh, to roll them like a burrito, you
Oh,
lay
I
them on
got you.
there,
You're
you
using
go
the blanket.
over,
Right.
cut,
Gotcha.
you go
I didn't know
up,
if there was
and
a,
then you come over again.
So
and
head,
cut.
yeah,
yeah.
what Pete's sitting there saying is you would have the baby kind of almost in the middle
In the, yeah, or up
of
towards the
this or at
corner.
a corner.
Choppy, hop up, let her.
The easiest way is to take this thing, put baby's